Well, we have a good reason not to skip that checkup at the dentist. Your gums can be a good indication of something key to your overall health.
The Fox Medical Team's Beth Galvin has more on the connection between what's happening with your gums and your heart.
There seems to be a pretty clear connection between gum disease and heart disease, but experts aren't really sure how the two are linked. Here in Atlanta, Dr. Alex Rodriguez says he thinks that gum disease may release bacteria into your bloodstream, and that bacteria may cause inflammation that can damage your heart. Inman Dentistry's Dr. Alex Rodriguez says our gums should be pink and elastic.
The gum fits around the tooth like a turtleneck. Okay, so there is some normal space down in between the tooth and the gum.
But when bacteria get trapped just under our gum line, that can be the beginning of gum disease.
It irritates the gums, irritates the teeth, creates these spaces around the teeth where bacteria start collecting, and that bacteria aggravates the body.
But Rodriguez says the bigger issue is inflammation.
If you added up all the space around those teeth of somebody that's got some severe periodontal disease, all that surface area added together, they estimate it's about the size of the palm of your hand. That is a huge wound, and that huge wound, if you're walking around with that, of course your health is going to be compromised.
So how do you know if you have gum disease? Look for signs like red irritated gums, bleeding after flossing, pain when you chew or bite, or receding gums. The treatment is usually a procedure called scaling or root planing.
Typically what we do is we numb it, we get in there, we scrape it off and get the gums nice and clean. But when you don't have that done and that stuff persists and you've got that open wound essentially, all that inflammation builds up, it gets into your blood, and it travels throughout your whole body.
You can prevent gum disease by brushing your teeth in a circular motion twice a day. And Rodriguez says if you're not flossing, start. And if you're smoking, stop.
One of the other biggest risk factors is smoking. Anybody that's a smoker, you're going to have worse gum disease.
And the link between irritated, angry gums and other health problems is so strong. Rodriguez says heart and orthopedic surgeons often send their patients first to him before they'll operate.
They want them to get cleared. They want to make sure there is no active infection, because if there's an active infection in the body, anywhere in the body, in the mouth especially, it will complicate that surgery.
The key to keeping your gums healthy is to be vigilant. You want to brush twice a day, floss at least once a day, and get in for regular checkups. And if you think you may have gum disease, talk to your dentist about your options. For the Fox Medical Team, I'm Beth Galvin.